Hi, this is Patty Jackson. On this edition of Patty TV, we're talking about women and fibroid issues. We've got Dr. Lou Domenico. He's joining us to tell us about the treatment options, what's being offered, how a woman who is suffering from this can get help. It's good to meet you. How
Nice
you
to
doing?
meet you, Patty. Thank you very
What
much.
are some of the treatment options? Because this is something that you're hearing about more and more, and in younger women, like women in their 20s and in their 30s. What are some of the treatment options?
Sure. Typically, treatment options for fibroids begin with medical treatment with hormonal therapy and treatment of anemia with iron supplementation. But unfortunately, symptoms progress frequently, and patients are faced with intervention, which includes surgical options such as a hysterectomy or a myomectomy procedure, or something less invasive, which is what I perform, called a uterine artery embolization procedure.
This procedure, is it painful?
Well, after the procedure for about a week, you'll have a conglomeration of symptoms called a post-embolization syndrome, which as part of that you will have some pain. And so we know that up front, and we'll try to actively manage those symptoms, including a regular pain medication regimen, and that should really help to control pain to a manageable level.
Does it require a woman to take a lot of time off from work?
About a week of time, and patients are back to their normal activity level. But for that week, it feels like you have the flu, and so you're going to be tired and laid up and off for about a week of recovery time.
What about a woman in her childbearing years, and she gets this procedure? Can she still get pregnant afterwards?
Yeah, there are patients who have become pregnant successfully after a fibroid embolization procedure, but if you're actively trying to conceive and you have fibroids, the first line treatment is recommended as a myomectomy. There are patients who are not candidates for surgery, or patients who have a big aversion to surgery, in which case we can consider doing a fibroid embolization for them.
What are some of the follow-up things that a woman can do? She gets a procedure and life afterwards.
Life after fibroids, yeah, hopefully things go smooth sailing and symptoms don't recur, but in order to make sure that that's the case, we'll have these patients regularly followed up, and that will be by phone call for the first week after the procedure, make sure that there's no problems, and then at a month we'll see patients back in clinic, and about 3 months after that time as well. Make sure that symptoms are going the way we want, and make sure that there's nothing else there that we need to be aware of.
If you're suffering from fibroids, it's something you can get a handle on. You don't have to live with fibroids. You don't have to feel I have no one to talk about this to. What's going to happen to me? Can I still have children? Dr. Lou is here. Please give us a website and a number where people can reach you.
Sure. The phone number is 866-996-9729, and the website is aacinterventional.pa.com.
If you're suffering from fibroids, you can get help, and he is here to help you. So call the number today. Thank you.
Thanks a lot, Pat.